we're a busy department, we're a busy emergency department who we see on average 160 patients a day, and it's really important that we get that care right. One of the, so we had some feedback which pointed out that carers weren't allowed in beside their patients, the patient that we had in the department, for a prolonged amount of time. So they didn't know what was going on, they didn't know what we were doing with them, and they were worried and anxious. So the feedback we got was that they were keen to get in beside their loved one to find out what was going on.
Okay. So what did you do with that feedback then?
Well, we shared it with the staff, and we looked at what our practice was, and our practice was to have done the basic workup on the patient at the beginning of their journey, with just the nurse and the doctor and the patient, and we left the relatives waiting in the waiting room. Once we'd done all that, we would then go and get them. That did cause delays, as I've already highlighted, and we probably weren't aware of the length of time that there was a delay. So we shared it with the staff and worked out what we could do. So we've done it in two different ways. The first way, what we decided to do was that we would just make sure that actually we immediately got the relatives round. You know, as soon as there was time, if there was relatives in the waiting room, reception staff had phoned, we would say just send them round. Reception staff were quite helpful with this as well, so we got them round and in beside their family. So by letting the staff know that we'd had this feedback, it allowed them to think, actually, wait a minute, we could do things better.
Mm-hmm. So that's the impact that it's had then for staff?
Absolutely, it's had a big impact on staff. It hasn't been easy. A lot of staff have felt historically, well, no, wait a minute, we wouldn't want carers here while we're taking blood, we wouldn't want a relative here while we're doing an ECG recording. So we obviously treat each patient as an individual, but with discussion with the patient, we would then say, are you happy for us to allow your daughter to come in beside you while we're doing this, or would you rather wait? So staff have actually built on this and actually made it fit each individual patient, so it has worked really, really well. It's also had an impact on the wider team. It's helped. Our reception staff were finding it particularly difficult because they would have extremely anxious relatives going backwards and forwards asking what's happening, and they would phone to find out, so we had constant phone calls. So we've now eradicated that, and the reception staff now just come round themselves. If the curtains are drawn, then they chat the door and say, can we come in? So they don't phone us, so the nurses aren't constantly answering the phone to them, and the patients are round beside the relatives really quickly. And we have had no further issues, and it's working really, really well.
Great. And that's as a direct result of feedback from a patient and a carer?
Absolutely. I mean, it's probably something we were aware of, but the fact that it's been highlighted to us allows us to sit down and actually think, okay, right, what can we do? How can we solve this? So, and all the staff are now well, bought in and happy to do it. There is another positive in that you've got somebody beside, if we have cognitively impaired patients, then you've got their carer with them, so that supports them. You've also got, when the clinician goes in to examine the patient, you've got another person that can, help support the patient with what's happening, help them understand what's happening as well. In a busy department, that works really, really well.
So why do you think it's important then to get feedback like this via patient opinion?
I think it allowed us to actually think, somebody's highlighted this, and so we have to do something about it. So it pointed us in the right direction. We just work day to day doing the actual job, without actually thinking of the impact that some of the things that we're doing is having. So somebody's pointed this out to us and allowed us to think, actually, wait a minute here, what we're doing is not quite right, can we do it differently? So it's just people looking at it from a different angle. You don't see it when you're looking at it as a clinician.
Brilliant.